So when patients come into our office, we do the normal preoperative diagnostic testing for our LASIK and our PRK evaluations, which includes corneal topography, tomography, epithelial mapping, and now we're including the AvaGen genetic testing. You know, over the time, we started with just topography, and then we added tomography, then we added epithelial mapping. I always feel each step of the way is a value add to make a better decision if somebody's a candidate or not for a laser vision correction procedure. And so every step of the way, now we added AvaGen. It's a genetic test. It's one more value add safety level to make sure we're making a proper decision on if a patient can have surgery and which procedure would be best. So the way we implement it is a patient at their pre-op evaluation. If they qualify, then we get the diagnostic test done. We do the AvaGen swab. It's a really buccal swab, really easy, right in the office. They actually pay for that up front, non-refundable, and then we wait for the results. And if everything's good, we schedule them for surgery, and they just pay the difference for what they owe for the procedure. If it's a borderline test and we're concerned, we'll just talk to the patient. We may convert them from LASIK to PRK, or we may just say they're a non-candidate, or may say maybe ICL is a better procedure because we're not touching the cornea. Either way, it's helping our decision-making process to make it safer for the patient in the end. So that's the beauty of AvaGen testing in our pre-surgical evaluations. For keratoconus, it's a whole different thing. Patients come in for cross-linking for keratoconus. They already know they have keratoconus, and so we recommend that their siblings and or offspring, so their brother, sister, or children, get genetically tested. And then once they come in to do the test, then we bring them in to review the test results with them and get baseline testing. And if they're bad enough at a stage where we think so, we'll do cross-linking at that stage. If not, we'll watch them closely, and if they progress, then we'll cross-link them in the near future. You'd be surprised what we find. Some people actually are at a stage where they actually need corneal transplant. Some people come in at a very early stage, we catch it very early, and we'll do, from doing the genetic testing, we'll end up cross-linking them. So the best thing about AvaGen testing, two purposes: pre-surgical evaluations for our LASIK or PRK patients, and the other is for keratoconus patients, making sure there's no other family members, siblings and offspring, kids, to make sure they're not at risk and prevent them from getting to a stage that they got to where they only had one bad eye already and they came in to get cross-linking. We want to prevent any bad eyes way early in the process. So AvaGen in the end is a value add. It adds safety whether it's a keratoconus patient or a pre-surgical laser vision correction patient. Yeah, so from AvaGen, when a patient gets their genetic testing, we get an actually formal report, which is nice, so we can scan it into the chart and be part of their chart. But it's really easy to read. It's all color-coded. It comes with objective data. First of all, it tells if a patient has a corneal dystrophy and whether they have it or not. And the other thing, it actually gives us a genetic score for the risk factor for them potentially having genetic risk for keratoconus. And so the higher the number, the higher the risk. 0 is 0, 100 is a high risk. So it's real easy. If it's 100, you know you got to reassess what you're going to do for the patient. If it's 0, it's real easy. I can proceed with surgery. If it's right in the middle, that's where you say, you know, there's risk factors. The beauty is AvaLino provides genetic counselor counseling for both the doctors as well as the patients to help understand and interpret the score. So that's a nice value add the company adds, because we're not geneticists and sometimes it's hard to interpret it. But either way, it gives me one other step in the process to bring safety to the patient and make better clinical decisions on what to do next. So why genetic testing? Well, when I look at a patient's eye, I don't see genetic results. I can see if they have keratoconus, I can see if they have an abnormality. I can do diagnostic imaging, but you still don't know anything about the genomes or the genetics for a patient. So the beauty of it is, it's something I'm discovering about a patient that we can't see on exam or by any diagnostic testing. So the AvaGen test allows us to bring one extra level of safety and clinical decision making. I would advise, if you're really interested in genetic testing, like myself, it's made a big difference in my patient decision making for my patients, is to come talk to AvaLino, reach out to them and they have genetic counselors that can help you understand the test results, and their clinical team will actually be happy to tell you all about the testing.